Hi, my name is Jonathan. We'd like to thank all of you has been watching our videos and subscribe it from the thyroid problem to the T-cell exercise to treat all kind of immune problems. Today I would like to share other experience I have. Lately I found out a lot of people suffering with neck and shoulder tightness such as headache, dry eyes, and vision problems, nose and ear problems. Not only like that, sometimes fatigue and cannot focus of the work or feel heaviness on the head. All these problems can be caused by simple your cervical spine out of alignment. Cervical spine C1 and C2 is connecting to our head. Our head is weight 1/10 of our body weight. If you are 150 pounds, that means your head almost 15 pounds. It looks like a heavy bowling ball on the top of your neck. Thinking about our neck constantly try to holding our head, that causes a lot of the stress on our spine. Originally, our spine designed for that way, but nowadays, because the posture we using our computer and cell phones cause a lot of neck problems. Today, I would like to share some of the clinic experience that I had to solve this problem in a very short period of time. More important, it works. First, I have 26 years old diabetes patients suffering a lot of neck tightness. I checking his neck is so tight that's not easy to release the pain. Through the exercise, the neck being stronger. What happened about his neck? Because his neck first two vertebrae is out of alignment. So the muscle is constantly tied up to holding the neck. That's the mechanism our body to protecting ourselves. Not only like that, because diabetes patients already have difficulty for blood circulations. So the microsystem easy to get blocked. Through the Mr. Goose exercise, helping open up the blood vessels so the blood can flow smoothly. Also, through the exercise, correcting the structure of the spine. That's why after the treatments, only 2 or 3 minutes, he can find out he can focus better and he can sleep much better as well at night. The other case is a 48 years old female suffering with breast cancers. Because not only she had breast cancer problems, but also she had constantly feel neck tightness and headache. Through the Mr. Goose T-cell exercise, her T-cells work much better. I also noticed a lot of my cancer patients have neck problems. Sometimes when you palpate their neck vertebrae, you can find a lot of sensitive spot around the neck. Because that reason blocking the nerves connection between brain and thymus glands. So through correcting the neck areas, we're helping cancer patients regain their function of T cells. With the good health T cells, they can fighting for the cancer. So after the Mr. Goose neck exercise, she suddenly have a lot of warmness coming up to her head and sweating a lot. She already did a T-cell exercise for a while, but without open the neck, it's difficult to really connecting the brain and thymus glands. At that moment, when she do the neck exercise, not only just release her headache, but also helping her can focus better. These two cases sounds magic. Of course, it also can work on you. Is anyone cannot practice this neck exercise? If you have hypertension, to prevent your pressure of the blood shooting back to your head cause a stroke, please contact with me before you do this neck exercise. People with shoulder and neck problems, eye dryness and vision problems, ear, nose problems, and also constantly headache, feel like fullness of the head, or people cannot focus. This exercise is very helpful to open up our cervical spine C1 and 2, which is difficult to open it. Now let's do the exercise together so you can see the great result yourself. The first movement is try to open the neck point, especially working on the cervical spine 1. You want to put your hand just right on the point where I show on the pictures. And the other hand put opposite side of the head. So you can see I'm penetrate both them to holding my head together. Not only like that, so you're just holding on the corner of the top of your head. So you want to do is lift up your head directly up and using your hand to do the swing on the neck area. This helping you to open up the cervical spine of C1. C1 is on the neck, so you holding it, lift it up. Not only like that, so you rolling it to slowly correct the structure. Now we are going to do the other side. Same thing, put your hand on that spot. And using your hand put on top of the corners, you will lift up your body and using your palm to rolling your head and using your thumb as the pelvic point. So you really rotate it. Let's see from the side. So I'm holding my neck up, point it up, and rolling. So you can find a soreness sensation on the side of the neck area. The second movement, we are going to correcting the cervical spine 2, C2. Using your palm, touch your jaw, and make sure you want to do is holding your jaw back and push upward, so elongate your spine. And you want to do is holding it directing to the back, so you're working backward of your C2. So you can find out you are moving on this point of C2 area. So in the front it looks like this. So you put using your palm, put on the bottom of your jaw, make sure you push inward and lock your chin in and up until the max bar you want to do is pushing it to the back. You can find out this area getting warmed up very quickly. To enhance the C2 become stronger, the other way I can do is using my hand to holding on low of my jaw and put my hand on the C2 area as the picture show. So you want to do is holding one hand there and lift up your neck and push backwards. You can do this movement for 10 to 30 seconds. The third one, you want to working on the C2 again. We want to do is C2 backward, now we want to do the C2 forward. So they can really correcting the front and back out alignment. We want to do is using the hand grab back of our neck and using the other hand to holding and stabilize our jaw. You want to do is lift up your neck as high as possible. Then open your jaw and clench your jaws. From the side, looks like this way. So you're holding your jaw, lift up your neck as high as possible to elongate your spine. Then you want to do a rotation. So you are not only just the second movement is moving the C2 backwards, now you're moving forward. Again, do this exercise for 10 to 30 seconds. The fourth movement is try to stretching our neck, trapezium muscle and our neck muscles. So first, you want to put both your hands under your jaw. Make sure you elongate your spine and push your jaw in upward directions. At the same time, you want your chin slightly tuck in. You don't want to do this. That's only stretching your side of your neck. You will really want to working on all the neck. So you want stretching all the way up, then push all the way up to the top. This helping stretching the neck areas. So do this exercise for 30 seconds. After you did all the 4 movements, now let's repeat again from the beginning. In the beginning, you want to loosen up the area. Now, the second time when we do it again, this time is correcting the structure. Because when your muscle is so tight there, you want to stretch and loosen it up first. Now you want to do is working on it. So the first 4 movements we did is try to release the muscle tightness. Now we are working on to correcting the joint. Every movement we can do 15 seconds to 30 seconds. Now let's start on the first one. That's the first movement. Second movement we want to do is on the chin. Or we can use in this way. Third movement, we are going to move the cervical spine forward. Fourth one. You can see my facial compress is getting more red. And at this moment, I can feel my head actually light up. So it's clear and my thought is easier. My eye is brighter. So this is the benefit from this exercise. Please do this exercise daily. You can do 30 seconds for each movement. Make sure you do all the 4 rounds twice. Practice this exercise 1 or 2 times a day. You can find out a lot of problems you had on the neck and head can easily be solved. Thank you so much for watching. I will see you next time. Bye.